This presentation is one of the State of Iowa Retirement Benefit Highlights series. This short informational video offers valuable information regarding your State of Iowa retiree benefits. This presentation highlights general information regarding retiree health insurance after you are eligible for Medicare, which in most cases is at age 65. Turning 65 is one way an individual can become eligible for Medicare. An individual can also be under 65 and eligible for Medicare by receiving Social Security Disability Insurance, or SSDI, for more than 24 months. If an individual receives SSDI because of ALS, Medicare automatically begins the first of the month that SSDI benefits start. Another way an individual can become eligible for Medicare is if under age 65 is diagnosed with end-stage renal disease. Health coverage is not automatic when you or your spouse become eligible for Medicare. New health insurance applications must be completed. DAS mails state retirees and spouses information about their health insurance options and applications approximately 3 months before turning age 65. Hospital insurance, Medicare Part A, helps pay for inpatient hospital care, some inpatient care in skilled nursing facilities, home health care, and hospice care. Medical insurance, Medicare Part B, helps pay for medically necessary doctor services, outpatient hospital services, and a number of other medical services and supplies that are not covered by Part A of Medicare. Medicare Part D provides coverage for prescription drugs. Most people do not have to pay a monthly premium for Medicare Part A because they or their spouse paid Medicare or FICA taxes while they were working. You pay a premium each month for Part B. Medicare Parts A and B pay for many healthcare services and supplies, but it doesn't pay all of the healthcare cost. There are costs that Medicare beneficiaries must pay, like co-insurance, co-payments, and deductibles, and these costs are sometimes called gaps in Medicare coverage. Medicare Part A has deductibles and co-pays. After the deductible is met, Medicare beneficiaries pay 20% for Medicare Part B expenses. As a Medicare-eligible retiree, Medicare is the primary insurance regardless of any other health insurance you have. A Medicare-eligible retiree needs to enroll in Medicare Part A and Part B. The state's health insurance plan pays after Medicare. A Medicare-eligible state retiree has 4 different health options to select from: Iowa Choice, National Choice, Group Program F, and Group Program N. In addition, a Medicare-eligible state retiree can enroll in the Iowa Group Medicare Blue RX, a Medicare Part D plan. You can continue coverage with Iowa Choice or National Choice when you become eligible for Medicare. The benefit design of Iowa Choice and National Choice is the same as the benefit design offered prior to becoming Medicare eligible, except Medicare becomes the primary payer on your claims and Iowa Choice or National Choice is the secondary payer. If you have covered dependents who are not eligible for Medicare, Iowa Choice or National Choice will continue to be primary on their health claims. These are the current monthly premiums for Iowa Choice and National Choice for Medicare-eligible retirees. To lower your well-marked premiums, you have the option of enrolling in Iowa Group Medicare Blue RX, a Medicare Part D plan. Iowa Group Medicare Blue Rx coordinates pharmacy benefits with the pharmacy benefit provided by Iowa Choice and National Choice. Group Medicare Blue Rx is primary on prescription drugs, and Iowa Choice or National Choice is the secondary payer for prescription drugs. Iowa Group Medicare Blue Rx and Wellmark coordinate prescription drug benefits. Enrollment in the Iowa Group Medicare Blue Rx plan significantly reduces the amount Wellmark pays for prescription drug coverage. These savings are passed along to you in the form of lower premiums for your Iowa Choice or National Choice health coverage. To see the savings, let's look at Iowa Choice single coverage. If the Medicare-eligible retiree elects Iowa Choice single coverage and the retiree does not enroll in Group Medicare Blue Rx, the premium is $851. On the other hand, if the retiree enrolls in Group Medicare Blue Rx, Wellmark lowers the premium to $409 for a savings of $442. Factoring the Group Medicare Blue Rx premium, the net savings is $343.10 per month. For every plan and coverage level, the Medicare-eligible retiree saves money by enrolling in Iowa Group Medicare Blue Rx. Let's discuss the two options only available to Medicare-eligible state retirees, Group Program F and Group Program N. Medicare Parts A and B pay for many healthcare services and supplies, but it doesn't pay all of your healthcare cost. There are costs that you must pay like coinsurance, copays, and deductibles. These costs are sometimes called gaps in Medicare coverage. A Medicare supplement plan or Medigap plan is private insurance companies to fill the gaps in Medicare Part A and B. The benefit design of the state's Group Program F and Group Program N is identical to an individual Medicare Supplement Plan F or N. With Group Program F and Group Program N, you can see any provider who accepts Medicare nationwide. Group Program F or Group Program N only covers Medicare-eligible expenses not paid by Medicare. If Medicare covers the service, Group Program F or Group Program N will cover the service. You may have heard the Medicare Supplement Plan F is no longer available. Effective January 1, 2020, an individual Medicare Supplement Plan F cannot be sold or issued to a newly eligible Medicare beneficiary. Since the state's Group Program F is a group plan, the state is still able to offer the plan to state retirees. You are eligible to enroll in the Group Program F or Group Program N if you are a Medicare-eligible state retiree or a Medicare-eligible surviving spouse of a retiree. If you currently have family coverage and you enroll in Group Program F and Group Program N, your spouse and dependents must also enroll in Group Program F or Group Program N. If your spouse and dependents are not eligible for Medicare, they are not eligible for the Group Program F or Group Program N, nor can they have a single coverage with Iowa Choice or National Choice. If your spouse or dependent is eligible for Medicare, but you are not, they cannot enroll in Group Program F or Group Program N until you, the state retiree, is also eligible for Medicare. In the situation where one spouse is Medicare eligible and the other spouse is not Medicare eligible, the only way to cover both spouses is to elect either Iowa Choice or National Choice family coverage. What does the Group Program F cover? Group Program F pays the full Medicare Part A deductible amount each time it is. Program F pays 100% of the skilled nursing copayment benefit. The Group Program F covers the deductible for Part B covered services and the 20% coinsurance. Group Program F coverage also covers excess charges. Some doctors decide to charge 15% more than Medicare pays them. This excess charge is then your responsibility to pay. Group Program F coverage will pay it for you. And this is a nice feature because you don't have to worry about whether your doctor is one who charges excess charges. What does the Group Program N cover? The Group Program N pays the full Medicare Part A deductible amount each time it is charged. Group Program N pays 100% of the skilled nursing copayment benefit. You are responsible for the Medicare Part B deductible. The Group Program N covers the 20% coinsurance for Part B expenses, except for a $20 copay for office visits and a $50 copay for emergency room visits. Group Program N does not cover excess charges. Some doctors decide to charge 15% more than Medicare pays them, and this excess charge is then your responsibility to pay. Medicare does not cover care received outside the U.S. Group programs F and N include a foreign travel emergency benefit only for emergency care that begins within 60 days of leaving the U.S. You are responsible for the first $250 each calendar year. Once the deductible is met, the Group Program F and N will cover 80% of billed charges paid for medically necessary emergency hospital, physician, and medical care received in a foreign country up to a $50,000 lifetime maximum. You are responsible for 20% of billed charges and any amount over the $50,000 lifetime maximum. Because the Group Program F and Group Program N are single contracts, you and your spouse or domestic partner can both enroll in Group Program F or both enroll in Group Program N, or one enroll in Group Program F and the other enroll in Group Program N. If you are enrolled in Group Program F or Group Program N, you will need a Medicare Part D plan to cover prescription drugs. You can elect Iowa Group Medicare Blue RX plan, or elect an individual prescription drug program from an insurance company offering a Medicare Part D program in the state where you live. In this example, spouse 1 is age 65 and spouse 2 is age 62. To cover the couple, the state retiree elects either Iowa Choice or National Choice family coverage. Spouse 1 enrolls in Iowa Group Medicare Blue RX in order to have the lower premium. For spouse 1, Medicare will be primary and Iowa Choice or National Choice would be secondary. For spouse 2, Iowa Choice or National Choice, whichever one the state retiree elected, would be primary. When spouse 2 turns age 65, the couple have a number of options available to them. The state retiree and spouse can elect Iowa Choice family coverage. Both the state retiree and spouse elect Iowa Group Medicare Blue RX to have the lower premium. Elect National Choice family coverage. Both the state retiree and spouse elect Iowa Group Medicare Blue RX to have the lower premium. Or state retiree and spouse can elect the Group Program F or Group Program N. And because the Group Program F and N are single contracts, they can each select different plans. In this example, the state retiree is age 65 and the spouse is age 64. The state retiree elects Group Program F and the Iowa Group Medicare Blue RX. Because the spouse is not Medicare eligible, the spouse cannot be covered by a state health plan. When the spouse turns age 65, the state retiree can add the spouse to coverage and they have all the health care options available to them. This table looks at premiums for single coverage. The Medicare-eligible state retiree has 6 different health options to choose from. National Choice, with or without Iowa Group Medicare Blue Rx, Iowa Choice, with or without Iowa Group Medicare Blue Rx, the Group Program F, and the Group Program N. The retiree has the option of electing the Iowa Group Medicare Blue Rx plan or elect an individual Medicare Part D if enrolled in Group Program F or N. In these examples, we have included the Iowa Group Medicare Blue Rx premium. This table assumes that the retiree does not pay a premium for Medicare Part A. The Medicare-eligible state retiree pays the Medicare Part B premium. Medicare Part D, which is the Iowa Group Medicare Blue Rx, is $98.90. The next column is the state premiums for the different health options. And finally, all the premiums are added together. For 2021, total premiums for a Medicare-eligible state retiree range from $422.80 per month to over $1,000 per month. Now let's look at family coverage when only one retiree is Medicare eligible. In this situation, you only have 4 health options to choose from. National Choice, with or without Iowa Group Medicare Blue Rx, Iowa Choice, with or without Iowa Group Medicare Blue Rx. Enroll in Group Program F or Group Program N, and the other family member enroll in single coverage in Iowa Choice or National Choice. The table assumes that the Medicare-eligible retiree does not pay a premium for Medicare Part A. The Medicare-eligible retiree will pay the Medicare Part B premium. Medicare Part D is Iowa Group Medicare Blue Rx. The next column is the state's premium for the different family coverage health options. And finally, all the premiums are added together for a total amount of the premiums that you would pay. Now let's look at family coverage when you and your spouse or domestic partner are Medicare eligible. The Medicare eligible state retiree has 6 health options to choose from. This table assumes that both the retiree and spouse or domestic partner do not pay a premium for Medicare Part A. Both the retiree and spouse or domestic partner pays the Medicare Part B premium. And both the retiree and the spouse or domestic partner pays the Medicare Part D premium. The next column is the state's premium for the different family coverage health options. In this example, we assume both the state retiree and the spouse or domestic partner elect Group Program F or Group Program N. Finally, all the premiums per each option are added together for the total amount of premiums you would pay. To continue dental insurance, the retiree pays 100% of the premium. The spouse is able to continue dental coverage when the retiree passes away, as long as the spouse is enrolled in dental coverage at the time of passing. Finally, be aware that Medicare is not a dental insurance plan. You may decide not to continue with the state's health insurance coverage, but you can continue with the dental coverage. Additional information about retiree benefits is available on the DAS Benefits website. Enter benefits.iowa.gov in your search engine. At the DAS Benefit website, click on Retirees. For detailed information about Medicare, the Medicare and You Handbook is a great source of information. Another great source of information regarding Medicare is the Senior Health Insurance Information Program, or SHIP. SHIP is part of the Iowa Insurance Division. SHIP is a free and unbiased service of the state of Iowa to help Iowans make informed decisions about Medicare. SHIP has trained volunteers across the state. You can find a SHIP counselor by calling their toll-free number or by visiting their website. In addition, SHIP has Welcome to Medicare presentations you can attend. If you have additional questions about continuing insurance benefits at retirement, contact your agency's Human Resource Associate or email stateretirees@iowa.gov. Thank you for taking time to learn about the state of Iowa retiree benefits.